Hi, my name is Jeff Stuart. I am a physician anesthesiologist in practice for about 30 years at this point, who has held several leadership roles along the way, both within the medical staff side of things, the administrative side of things, and a partner of mine with a similar background and I started early 2024 a new company called RxSolve Conflict or Resolve Conflict. And what we're doing is we're working on building conflict competence within hospitals and healthcare organizations, including medical groups, by not only getting involved with active conflict management through mediation. We're both trained mediators and facilitation, but also we've done some and are trying to explore doing more training for medical staff leaders as well as younger physicians, including doing some coaching. And really the impetus for this came during the pandemic when I was chief medical officer of a community hospital in Fremont, California called Washington Hospital. And my friend Paul Natterson, who was my business partner, was also the chief medical officer as well at a hospital in Los Angeles. We both had really good timing taking the jobs about 3 and 6 months before the pandemic started. So I guess we have that going for us. But actually, counterintuitively, I really feel like I never had learned more since internship than this, what I experienced during the pandemic. And Paul and I would commiserate every Saturday during the pandemic, at least once a week, kind of brainstorming about things for our hospitals and just kind of listening, giving each other somebody to listen to as well. And we kind of coalesced around things we had been successful at and, the biggest challenges. And we realized we both had been pretty successful in uniting the doctors and administration, not just during the pandemic, but prior to it. And we really kind of dug into why that was the case. And we kind of came to the thinking that it was, we happen to be good listeners with a relevant skill set to doing this kind of work. And we'd learned both of us have had well over 2 decades in medical staff and physician leadership. We learned this all on the job. And, really it's lacking in most hospitals if there's any training for this. And we just happened to be lucky to be blessed with a skill set that matched, the need at the time. And as we even kind of talked more about it and kind of were looking for something we could partner on together to, at this stage of our careers, which, for me is 30 years in, trying to help younger physicians and new physician leaders and really medical staffs in general, given what we had seen and sort of the lack of help we were provided, to be frank. We came to this realization that there's a lot of physician leadership training out there, but this kind of aspect of conflict and difficult communication is really ignored. And there are resources out there for nursing staff and others, but really not so much directed at the physician. And thus our company Resolve Conflict was born. As I said, we both had done some mediation training, formal mediation and coaching training. We also, our third partner actually happens to be my wife, who's a physician and was a mediator and a conflict coach prior to our forming the company. And at this stage, we are, as I said, maybe 1.5 years into the company, but about 4 or 5 years into our research, and have really found the community within this conflict management realm to be extremely supportive. And as a matter of fact, that was my conduit to Medvail, was in the context of this work being connected to Pam Holt, who also was exceedingly supportive and collaborative. And I'm really excited about her introducing and recommending me to Medvail. And as Maria and I talked about, it can be, I've experienced this sort of loneliness of thought, I guess I would describe it as, when I was a CMO during the pandemic, certainly. So this idea that I had to go outside my hospital system to find somebody like Paul to really talk to that could relate to what we were going through. And then now within this kind of conflict resolution, conflict management realm, really kind of seeing there's a community there to support us as we're trying to do that. And really as, people being in practice a long time with some significant business experience, not really the experience of starting our own business and consulting firm. excuse me. And so really looking forward to learning a lot here through everybody else in Medvale, and hopefully I can contribute as well, as that's the plan. And I'm just really excited about it.